Karel, thank you for taking a few minutes to talk to us about your issues. So you first presented me a while ago with some issues regarding your left foot and leg. And you were having some pains on the outer side of the ankle heading into the foot. Can you tell me a little bit about what your symptoms were like at that time?
I had a lot of pains that I could describe as a zinging pain, shooting pain. It was very painful to walk on, and it was all centered kind of on the left side of my foot, where I had broke my toes, and it just never seemed to get better.
And were those pains constant, or was it only a few hours a day?
The zinging pains came and went. The pain walking was all the time. And a lot of discomfort sitting with my foot out and in bed underneath the covers.
And on a scale of 1 to 10, how bad would you rate most of that discomfort?
Probably most of the time during the day, a 5 or 6. When I would get the pains, it would shoot up to an 8 or 9.
Okay. And so the first operation we did a while back was we actually diagnosed you with a sural neuroma. That's the name of the nerve. And there was an injury to it, and we went and we cut that nerve and we buried it in the calf muscle, but you only got partial relief with that. And so in February we went and we actually reconstructed that nerve. And the gap between the proximal and distal ends, that's the upstream and downstream ends, was about 6.5 centimeters. So we bridged it with an Axogen 7 centimeter nerve graft, which is a pretty long nerve graft. And now you're 6 months from that procedure. Tell me about your symptoms now.
Really, the only symptoms I'm having now are when I sit in a lawn chair, times that my heel is actually sitting on something with my legs stretched out. It doesn't hurt. It's more of a nuisance, discomfort. And I've just learned kind of how to put my foot sideways, cross it over my ankle, but I don't have the zinging pains. I feel so much more of my foot now than I did, which is very helpful in walking and balance and everything else.
So overall happy with the results?
Oh, very, very happy.
Okay, and just so you know, when we tested your 2-point discrimination, it was about 5 to 7 millimeters in the sural nerve distribution on the left side, which is the side we operated on, and pretty much the same on the opposite side. So your sensation is almost as good as your native foot. Anyway, thank you for taking the time to talk with us. Appreciate it.
Thank you for doing it.